Good morning everybody. Today's session is on the anatomy of uterus. See, at the end of this session, I want you all to understand the anatomy of uterus and apply this particular knowledge in your clinical practice. Then I have got certain specific objectives also about this class. Few are, see, you should be able to discuss the dimensions of the uterus, explain the parts of the uterus, then narrate the different layers of the uterus, identify the various supporting structures and list down the blood supply, lymphatic drainage and the nerve supply of uterus. And also you should utilize this knowledge which you acquire from this session in your clinical practice. Uterus is also called the womb. It is an inverted, pear-shaped, hollow, muscular organ situated deep in the pelvic cavity. Then, coming on to the dimensions of uterus. See, the human uterus is pear-shaped and is about 7.6 centimeters long, 4.5 centimeters broad and around 3 centimeters in width. Next is the parts of the uterus. First you have the isthmus. See, isthmus is on the surface about the midway between the apex and the base, and it is a small constriction. Okay, a surface constriction midway between the apex and the base is the isthmus. Next is the body of the uterus. The body is the portion above the isthmus. Then you have the cervix. Cervix is that part coming below this isthmus. Then you have the fundus, the part of the body that lies above the plane connecting the point of entrance of the fallopian tubes. Then you have the internal orifice, the interior narrowing of the uterine cavity of the uterus. See, you will be more clear with this figure. See, this is the isthmus. See, I told you isthmus is a small slight constriction. Yes, midway between the apex and the base. Then you have the body of the uterus. See, this is the body of the uterus. That is that part of the uterus above the isthmus. Then you have the cervix below the. Next is the layers of the uterus. See, layers of the uterus. Uterus is composed of 3 layers. One is the endometrium, then you have the, myometrium, and you have the perimetrium. See, endometrium is the innermost lining of the uterus. So, a particularity about this structure is that, layer is that, this is the layer that sheds during menstruation, and it is endometrium that actually helps in the implantation of the fertilized ovum. Now you have the ligaments. Ligaments are, it is held in place by several peritoneal ligaments. Uterus is held in place by the peritoneal ligaments. Again, there are 3 peritoneal ligaments: the uterosacral ligament, the cardinal ligament, and the pubocervical ligament. See, the uterosacral ligament is from the posterior cervix to the anterior face of sacrum. Then you have the cardinal ligament, which is from the side of the cervix to the ischial spines. And then last you have the pubocervical ligament from the side of the cervix to the pubic symphysis. These are yet another supportive structure, that is, you have the pelvic diaphragm, the perineal body, and the urogenital diaphragm. So altogether there are 3 ligaments and also the pelvic diaphragm, the perineal body, and the urogenital diaphragm, which all of these together helps the uterus to stay in its place. Next we have the blood supply. See, the blood supply of the uterus is mainly done by 2 major arteries. They are, you have the ovarian artery and also the uterine artery. Please remember, ovarian artery is from the branch of the hypogastric artery and the uterine artery is a branch of the abdominal aorta. Next is the lymphatic drainage. See, lymphatic drainage, it is again divided according to the parts of the uterus. First you have the fundus and the upper part of the body. That is, fundus and upper part of the body is supplied by the para-aortic lymph nodes and superficial inguinal lymph nodes. Okay. Then the lower part is with the external iliac artery and the cervix by the external iliac, the internal iliac and the sacral nodes. Then you have the nerve supply. See, the afferent nerve supply in the uterus are the T11 and T12. The sympathetic supply is from the hypogastric plexus and the ovarian plexus. And the parasympathetic supply is from the second, third and the fourth sacral nerves. Next is development. The embryonic development of uterus is basically from the Mullerian ducts during early fetal life. They say there are two Mullerian ducts that fuse to form the uterus. Okay, so that is about the embryonic development. Then you have the pathology, certain pathology associated with uterus, which I would like to apply anatomy. Okay, that is, you have the prolapse of the uterus. Prolapse of the uterus means uterus gets dislodged from where it actually should be and it comes down. So according to the degree of prolapse, degree of it coming down, you have first degree, second degree and third degree prolapse. So I can just tell you, third degree prolapse will be that most part of the uterus, or more than half of the body of the uterus, comes out through the vagina. Then here you have the adenomyosis. Adenomyosis is the ectopic growth of endometrial tissue within the myometry. Ectopic growth means what? Ectopic means out of place. Haven't you heard of ectopic pregnancies? Yes. Okay, sometimes instead of getting implanted inside the uterus, the fertilized ovum gets implanted in the fallopian tube, or sometimes in the ovaries or in the peritoneal cavity. That is ectopic, out of the actual place. So this is adenomyosis. That is when the endometrial tissue grows within the myometrial tissue. Then you have certain uterine malformations like congenital malformations can be there, which includes biconjugate uterus. Biconjugate uterus means the internal orifice is not fused, or you can see actually two uterus with one fundus. Okay, there are certain abnormalities, or sometimes there can also be a condition called as absence of uterus. So these are all certain pathological states or that can be associated with uterus. Okay. Then before we actually sum up, shall we just take a quick review of what we already saw? Yes, you know the structure of the uterus. Yes, we said it's a hollow inverted pear-shaped organ. Then about the dimensions, you know. Yes, then the various parts of the uterus. Remember, isthmus, body, cervix, internal orifice. Yes. Okay, then you have the different layers of the uterus, 3 layers. Then we saw the blood supply, the nerve supply and lymphatic drainage. Yes, then we also saw certain applied anatomy. Do you all clear with the anatomy of uterus? Please get back and read, and also you should learn to draw the different parts of the uterus and name the structures. So as an assignment, please have in your exercise book, please draw the figure and label it neatly and bring it to the class next day. Thank you.